Namaskar, hello and welcome viewers. You're watching this special presentation of Sansad TV, Bills and Acts, where we analyze bills that impact you, acts that empower you, and programs that matter to you. I'm your host Preeti Mishra, and today the spotlight is on the National Medical Commission Act. Before the detailed analysis, let's take a look at the highlights. The Act sets up the National Medical Commission. Within 3 years of the passage of the bill, state governments will establish state medical councils at the state level. Functions of the NMC include framing policies for regulating medical institutions and medical professionals, assessing the requirements of healthcare-related human resources and infrastructure. There is a uniform national eligibility cum entrance test for admission to undergraduate and postgraduate super specialty medical education in all medical institutions regulated under the Act. So why did we need this Act? Well, the Medical Council of India, the body in charge of regulating the medical profession before the NMC Act, faced corruption scandals. Further, MCI was alleged of promoting Inspector Raj, that is, inspections carried out by the MCI to ensure the maintenance of required standards by medical colleges and the malpractices linked with it. In this context, the NMC Act replaced MCI with a National Medical Commission. This Act has been billed by the government as the biggest reform in the medical profession and a pro-poor legislation that shall make quality medical care more accessible to the people. The Act seems to bring governance reforms in the medical field, addressing the needs of health services, standardizing quality to be maintained in medical education. And for deeper insights on the NMC, I'm joined by an illustrious panel of guests. Joining us in the studio, Dr. Manoj Rajoria, MP Lok Sabha. He represents the BJP. Also joining us, Preeti Sudanji. She has been the former Health Secretary of India. And joining us through virtual platform, Dr. Shivkumar Shankar Utture, President, Maharashtra Medical Council. Also in the studio, we have with us young and vibrant audience. I welcome all of you on Sansad TV and thank you so much for joining us. And Dr. Rajoria, let me begin the program with you. Now, talking about the urban-rural healthcare divide, 70% of our population resides in rural areas. We have only 20 to 30% of healthcare facilities, whereas in the urban areas, we have around 70% healthcare facilities. Now, this is a stark difference as far as urban and rural healthcare divide is concerned, sir. How do you think this particular act has addressed this big challenge?
Yeah, of course, this was a very biggest reform in the medical education and the practice sector of the medical education of India. Because as you are telling, that 75% population of the rural part of the India was suffering from the deficiencies of the doctors and the education, even the day-to-day routine treatment of there. So due to the deficiency of the medical treatment, due to deficiency of the doctors, due to the deficiency in the seats in the medical college, especially in the undergraduate and postgraduate courses, especially you can heard about the postgraduate courses, there was a huge amount of the donation to have a seat in the postgraduate courses. So there was a control on the MCI of the specific medical mafia, you can say, which was controlling all the medical education system and the health system. The people of the India was suffering from all these things. After 2014, when Narendra Modi came in the government as a Prime Minister, he thought about the welfare of the poor people and the rural people. Then he think what are the issues, why they are not getting the health facilities. So, to follow his instructions and view to serve the people of the India, of the rural, especially rural India as well as the urban, he decided to make a new reform and to make a new bill, which we can say National Medical Commission Bill 2019. I was the lucky man who was a member of this Standing Committee of the Health and Family Welfare. In 2016, we produced a report of 92nd report in the Lok Sabha, in which we demand that there should be a reform in the medical education and practice. So we are lucky, and people of the India, especially of the rural areas, are lucky that they have Prime Minister Shri Narendra Modi ji, and that time Health Minister Shri Jagat Prakash Nadda ji was the Union Health Minister. That good leadership inspired us to do hard work. We did hard work. We made a report and we present in the Lok Sabha as a 19-second report of the Standing Health Committee.
Right.
by which all the parliament was accepted, was agree with our requirements. Then they decided to bring a new bill which is in present form, that is called National Medical Commission Bill. But it suffered a lot. It
Yes.
took at least 3 hours to bring in the in ordinance, you can say. So after putting the report in 2017, we introduced the bill in the parliament. Then after that, the bill went in the Rajya Sabha.
Yes.
Then again it was dropped out, not passed out. Then again the second ordinance came in the 2019. Then again Prime Minister was strict that we have to do hard decisions in favor of the public of the India to provide them the better health care services and to provide the opportunity of the poor children's, of the children to those who want to be doctor, those who want to be served to the nation, and those who want to make career as a doctor and professional. So PM Prime Sri Narendra Modi gave us instruction to do hard work, and we are lucky to we have had opportunity to do hard work, and the National Medical Commission Bill passed in 2019 in Lok Sabha as well as Rajya Sabha.
Right.
So I think it was a very life-changing and very great bill in favor and in the service of the people of the poor India and the students, those who want to be doctor.
Thank you so much for taking through the journey of this particular legislation, sir. But you raised a very valid and a very important point about medical mafia. And since you've been also talking about the contribution of Preeti ma'am, let me take that to you. Now we have NEET in place. Uniformity of education was a very big objective of this particular act, of this particular legislation. 2019 and now 2022. Do you think things have changed as far as education, medical education in the country is concerned?
Certainly, I would say, Preeti, that if you will look into the pre-NEET scenario, then the students had to actually rush from one state to the other to give exams. And, it was very time consuming, it was also very torturous, and there was a lot of uncertainty. And there was also no standardized, I would say, examination by which children could prepare for entry into MBBS. So now, and NEET, I would like to point out, has stood the test of legal scrutiny. It has been time and again, it has been, scrutinized, it has been seen, and it has been, people have taken it in appeal to Supreme Court, but NEET has stood the test of time.
Right.
And yes, we used to get, representations. There is very important need to harmonize it to all the, I would say, the syllabus of the states, and that is being done. So I would say it's a great reform, and the students have benefited a lot from NEET.
Absolutely, ma'am. And let's also take this question to the doctor on our panel today, Dr. Shivkumar. I remember when this bill was getting passed in Parliament, or when this bill was in fact moved by the Health and Family Welfare Minister, there was a bit of resistance from a particular community of doctors. So from 2019 to 2022, do you think that things have changed as far as the medical fraternity is concerned?
Basically, as far as NMC is concerned, in the last more than 2 years, though it was a 2019 bill, it was passed. The NMC actually came into existence only in 2020. That's just around 2 years back. So yes, we have made a lot of changes in the National Medical Commission, also in the rules and regulations. Also, we have tried to bring a lot of transparency also. And we are trying to our best to become, student friendly as far as, the students are concerned. Even a lot of changes are being made in the curriculum as far as, the MBBS curriculum is concerned. Plus the training aspect also, the practical training aspect, which is the most important thing as far as a doctor is concerned. So that also has been brought into the curriculum. So there are changes which are going on, but as I said, we are just sitting over there for the last 2 years. Things are going to take time, but then I'm sure that positive changes will take place over the years.
Changes, Dr. Rajoria. When this bill was actually getting passed in Parliament, I again recall that there was one allegation that health is a state subject and this is going to usurp the power of the states. Do you think that matter is settled now, that concern is allayed now?
Every district of the India is now, after in this bill, getting medical college. I think all of you are aware about it.
Yes.
Every districts are getting medical college. Before this bill, there was medical college was settled in the big cities only, metro cities only. So poor people, those who want to take the medical education to serve the people, now they have more opportunities and the seats even I can say. Before this bill, there was 55,000 seats only of the MBBS. Now it is around 90,000 seats for the MBBS students and around 65,000 seats for the postgraduate postgraduate students. This bill is producing the quality, accuracy, transparency and responsibility also. Now states are accepting all these things because they are getting benefits. Before this bill, there was suffering from the deficiency of the doctors. They were suffering from the deficiency of the specialist doctors in the rural areas. Like there was no gynecologist, there was no ophthalmologist, there was no surgeons, there was no any neurosurgeon, even they do not have any CT scan or MRI machines also. Any even tertiary care centers were impossible to see in the big districts also, in my districts also. Now everything is happening. Now every people of the India are getting medical education. Now every son and daughter of the poor people can have dream that they can be doctor, they can serve to people, they can make their careers. So Prime Minister Narendra Modi and this bill are making dream of the healthy India.
Right, sir. But my next question stems from your assertion. Preeti ma'am, as sir said about community health workers. Now we understand that this act gives or grants permission, limited license to community health workers for bridging the urban and rural divide. But there was also an apprehension that this will promote quackery in the entire medical education system.
I don't agree with it at all. In fact, the reverse is true. You see, it's far from the truth. In the NMC Act, there is an enhanced punishment for quacks. So now there is provision of imprisonment up to 1 year and fine up to 5 lakhs. And I'd like to emphasize that there are 33 members in NMC, out of which 30 are doctors. So they are the stakeholders. After consultation with all the stakeholders, they will decide the qualifying criteria for limited license to such persons and specify the regulations.
Yes.
And the community health providers, mind you, we've seen during COVID that primary health care is so important. And as sir was saying that, you know, our Honorable Prime Minister has also included wellness in health, the preventive and the promotive health care. So to give a fillip to that, you see the community health provider will certainly play that role. So it's a step that is actually, I would say, it's a revolutionary step, and now other countries are also following us.
Right, it's a revolutionary step. Dr. Shivkumar, I'll quickly take your response at that before I go to my audience for their questions.
As of now, today, we are falling short of doctors, especially in the rural areas. Maybe down the line, since we have increased the number of seats to almost 94,000 per year, after 5 years, we are definitely going to have an improvement in that. But at present, as far as the community health workers, the concept is quite a good concept. The only thing is apprehension of the medical community was that how are you going to implement it and how are you going to keep a watch on if these community health workers will be doing exactly what is said in the bill. So that was the basic apprehension. So if we can take care of that in the NMC, I think it will be a win-win situation for everybody as far as this community health center workers are concerned.
Preeti ma'am, you'd like to respond to that?
Certainly, I would say that, 2-3 things I want to supplement.
Yes.
So community health providers are there across the world, incidentally. If you and they are providing a very, very critical role. And I'd like to say that if you see Asian countries, then Thailand is one example.
Yes.
Apart from that, I want to say that, 22 new aims, 159 new medical colleges, 97,813 UG seats now. We're going to reach the target of 1 lakh. 49,698 RPG seats. And then NMC, I would like to congratulate, they have actually included village and family adoption program
Right.
by MBBS students. So all this, so they will be available for the rural population. We are doing now non-communicable disease screening in the health and wellness centers. And doctors, specialists go from, medical colleges.
Right.
And with technology, also telemedicine has now taken roots.
Right.
So, therefore, I think the way we are proceeding is very heartening.
Now let's take some questions from our audience here. Please go ahead, introduce yourself and speak your mind.
What are the steps you have taken to minimize the corruption? I mean to say that what is the proper check and balance system you have arranged?
Now nothing is hidden. Everything is transparent. Everybody can find out their situation of the medical colleges. What is the grade of the medical college? Like you students, you can find out your grading of your colleges from the NEC grade or whatever facilities you have. You can see on website also like that only. Now you can see in which medical college you are taking admission, what kind of the facilities of the teaching infrastructure and their track record, what is there. Everything now are transparent. Now you can view, you can take your own decision and which medical college is suitable for the education for you and your career. Now everybody can apply on online only. Now it will be assessed at the center level only, and the state, with the help of the state, nobody known that who is going to inspect the colleges like that only. So I think the corruption chances are 100% stopped now.
So it has checked the Inspector Raj that we were talking
Yeah, of
about
course.
in the beginning. Let's take another question now.
Fees of private medical colleges is still very high, because of which our students are forced to go to Ukraine, Russia, these kind of countries. And my second question is, sir, you are saying that yes, medical seats are got increased, but still there are many less medical seats. Still we need more doctors. Still when we can accept from our government that these two problems get solved?
National Medical Commission have given all the powers to state governments to decide the fees. Now the board is there in every state. They can decide by the checking of the quality, education, infrastructure, expenditures and revenues of the college, or after the state level meeting in the leadership of the state health minister, they can decide fees of their state colleges only.
Right.
So now there are opportunities in that every student can decide their college, and the income and expenditures of the particular college have to put before the state government as well as the National Medical Commission. So, and if students come in the government college seats, I think every government college have minimum fees around 50,000 per year almost. So, almost negligible fees. And in private, in few states, there are 10 to 15 lakhs fees.
Right.
So, it depends on the expenditure, but we are trying to increase the seats also per year by year. So, I hope whenever the seats of the medical college will increase, the fees will come down. But the quality of the medical education should not be compromised. This is also one big question.
Yes, please go ahead.
So what do doctors need to do, or how do we convince doctors, or how do we incentivize doctors to not only work in big metro city hospitals, but also work in villages or in the ground?
All right, let's take that to the doctor in our panel, Dr. Shivkumar.
One thing, I'll just go a little bit back on the last question that was there. Recently, in the National Medical Commission, we have passed that as far as the fees are concerned, 50% of the fees in the private institutions, may it be deemed universities or whatever, will be equivalent to the the fees that are charged by that particular state government medical colleges, right? And 50% are left to the state government to decide according to their fee regulation committee, which is there. So if you see the total number of seats which are there, yeah, we have got almost 50% of the seats in the government medical colleges and 50% of seats in the private medical colleges approximately as of now. So if you see the whole 50% government medical colleges will have government fees, 25% of that, the private medical colleges will have also government seats. So that means 75% of the seats as of today will be as per the government medical college charges. The problem is, as far as the rural areas is concerned, and we are trying to sensitize the students also by having more and more programs in the rural areas. But at the same time, somewhere or the other, even as administrators, we will have to take into consideration of what are the facilities that we are going to make available for these young doctors who will be wanting to go to the rural areas, the infrastructure over there, the medications which are available over there. So, like for instance, if a surgeon goes to a rural area, there has to be a operation theater, there has to be an anesthetist, everything. So, I think we are working on that also. So, once we can do available all these things to these young doctors, then definitely I'm sure, because you see in the cities now the concentration of doctors is so much
Yes.
that you feel there are more doctors as compared to the population, and this has been proved by the statistics also.
That's right.
So slowly, it's a question of demand and supply. When the supply is too much in the cities, it's going to go to the tier 2 and tier 3 towns also.
Right, and I'm sure that the lawmaker on our panel has taken note of that very valid suggestion. Let's take another question now.
Sir, my question is that you promised to make 25 medical colleges in UP before the UP polls. CM Yogi Adityanath promised it. So I want to know that what's your vision for fulfillment of that?
I think government of India and government of the UP is going very fast to establish all these colleges. You will see all the colleges as soon as possible. It will come on the ground to serve the people.
Again, that's an important assurance. Let's take another question now.
Why is the medical fraternity opposing the National Medical Commission Act or bill?
I think
Preeti
nobody.
madam, you had dealt with the issue very closely.
I don't think anymore.
There were a lot of
You
protests.
see, yes, there were, yes, initially. Are there any protests now? No.
No.
Initially, because you see, anything new, you don't know. It's uncharted territory. So there are doubts. But I would like to say that Sir is here. He has played a very important role. It has gone through a rigorous process of consultation. And our department-related parliamentary standing committee, of which Sir was a member, they have actually gone through it word by word. There were 56 recommendations by them. 40 were accepted, 7 partly, and 9 were not accepted. I think this is the first time, sir, that in this bill. So therefore, and they have also given these after extensive consultation. So there is no longer any resistance. I think people are now realizing that, yes, this is what we need. We need to keep up with the times.
My question was regarding quackery. So, according to this bill, community health providers are entitled to prescribe medicines. This means that people who don't belong to a medical background can prescribe medicines and go ahead in the profession. So, how do you categorize it not to be legalized quackery?
So quackery is not a legalized. Usually there is a doctors we say they are not doctors, they are quackers. So they are practicing in rural areas, in villages, by writing the name of the doctor like this, only having false degree or fraud degrees like that only. But the power of the action taking against them is within the states only.
Right.
So the CMHO, Chief Medical Health Officer, can take legal decision against them, not the state, not the center government.
Of course.
So it depends on them only. But now, as a center government, we are trying to regulate all these things. Now we have ethics and medical board, the medical registration board, by which all the medical doctors of all our states and the center can then register themselves. Now, if they registered in one state, they can show and practice in every state of India.
As you said, this act aims to help poor students to become doctors. But the two major challenges which poor students from rural areas face is the dominance of coaching mafias and the dominance of
Education
English
mafia.
medium.
Yes.
What are the necessary steps taken for the mental wellness of the students as well as the doctor because of the pressure they are facing? So what are the steps that should be taken or like you are thinking to take?
So my question is to ma'am, since you already referred that the centers are being increased for the examination, that is NEET, UG and PG. So is it the all and end all of like making NEET more and more inclusive towards the students? Because you have already seen last year, a lot of students has been facing many problems in regards to the same. So in the name of security, they have been facing many problems facing specifically the girls' child.
So I think there is no need of the coaching now. This is just advertisement only. The student, they attract the students. Then they are putting their ideas that if you come to coaching, then we will provide you the facilities that you can get admission. Now everything is the transparent through the NEET. Every students have transparency possibilities. Now I think this is my humble request to every students and their parents. Then that they should focus on their basic 12th class syllabus and basic NEET syllabus. You are just asking about the difference between the Hindi and the English medium. I am lucky that I am working in the leadership of the Home Minister Honorable Shri Amit Shah ji, who is the chair, Adhyaksh and President of the Rajbhasha Samiti, which is working for the languages, especially of the regional languages, Hindi language as well as English language. So now we are providing the language support of the regional languages like Udiya, Tamil, Telugu,
Yes.
Kannada, Maratha, Gujarati. Students can read, and they, in new education policies, students should read their primary education in their basic
Regional mother tongue. Yes, sir.
mother tongue. And after that, they have provision of the Hindi medium also. Before few days, in last week, Honorable Home Minister Shri Amit Shah ji have inaugurated first medical courses in Hindi also in Madhya Pradesh now.
So about mental health, I'd like to say that you may have read that recently the Honorable Health Minister had actually inaugurated a hub and spoke
Yes.
facility of telehealth dedicated to only mental health. And also I would like you to go through the Nimhan's website, where during COVID we have created many lines, because and it caters to various segments of people, the elderly and the students, the children, the medical profession, the doctors. They faced so much stress, so that peer-to-peer mental health counseling could be given. And next is that you spoke about NEET centers. There has, you may have noticed that sometimes when there has been a representation, and I remember doing so, in 2019 we got a representation from Jammu and Kashmir about centers being less. They were opened even after the centers were notified.
Right.
So I think the government is very open to addressing the concerns of people, and I'm sure we want maximum children to take advantage of this exam.
Absolutely. Right. I'm completely out of time. Dr. Shivkumar, your closing remarks in 60 seconds, please.
Yeah, I think as I would like to touch upon this mental health aspect, because myself, for 35 years, I've been in the teaching line, and I've got a lot of students also under me. Now, two aspects you have to, think about as far as, saving these students are concerned. One thing is the ragging aspect when they come to the medical colleges. And for that, let me tell you, NMC has come out with very, very stringent punishments as far as anti-ragging. We have come out with a separate document of anti-ragging, how to tackle anti-ragging, what committee to make in the medical colleges and all that. So that takes care to a great extent as far as ragging is concerned. And second thing is the education itself. The pressure of that education also causes a lot of mental stress, suicides and all that. So what we have envisaged is to have something called as a mentor-mentee. We have also notified those rules, also regulations, where your teachers would be, they would be mentors for a couple of students. A couple of students would be, under them.
Right,
and they can directly, just like how you go to your parents and tell them what your problems are. Your teachers are like your parents in the medical colleges.
Absolutely.
So you can go and tell them what your problems are and try to get it solved by these senior teachers who have seen a lot in their, days of medical teaching and education and everything. So
right, sir.
we
Point
are
well
looking
taken.
into that also.
Right, sir. Right, sir. I'm absolutely out of time. Thank you so much for joining us, Dr. Shivkumar, Dr. Rajoria, and Preeti ma'am. Well, viewers, that's all I could pack for you in this edition. Thanks for watching and stay tuned to Sansad TV. Namaskar.